Welcome to another episode of Dent-Talks. And I hope this video finds you all in good health and perfectly safe and sound. I've been getting many calls and queries regarding the current state of affairs, regarding matters pertaining to this post-COVID patient management and treatment modifications regarding this patient when they come to your clinic. And with an alarming increase in the rise of the COVID cases, as well as increase in the cases of mucormycosis and other post-COVID related complications, I thought I'll prepare a video and include just the relevant parts which is actually pertaining to this particular aspect of managing or treating or consulting your patients who's coming to your clinic with the history of COVID-19. Well, let's move on to the presentation today. This is a talk. This is a topic which I would be actually highlighting upon management of post-COVID patients in dental practice. And I've actually classified this patients who's going to come to your class in your clinic in the current scenario into two groups. One is a post-COVID group, that means a patient who's had a COVID and being treated and then coming and reporting to your clinic for dental treatment. And the second is the non-COVID patient group who comes to your clinic, who's not a non-COVID COVID positive patient, but may or may not be having a subclinical COVID infection. Now, based on these two scenarios, I would be discussing the management part. First, let us take up the patients with the non-COVID history. Now, these patients who come to your clinic without any signs and symptoms of COVID or without any other history of getting treated for COVID, now you should take a proper detailed history and then look for the various signs and symptoms, which includes the use of thermometers and the pulse oximeter can help you tell whether the saturation part is quite okay and things like that. And of course, you have to find out whether the patient is coming from a containment zone or any zone which is actually marked as containment zone where there's increased chance of this patient to be also COVID positive. You should also inquire about the various travel history and the other schedules of the patient where he or she might have had any possibility of contracting this disease, and also find out and inquire about the vaccination status of the patient, whether the patient has taken the first and the second dose and is under cover for this particular disease. And of course, definitely anybody in the family has had this COVID disease, or anybody in the near relative have this COVID diseases. And if such patients, if the report is all negative in the earlier part as for the history is concerned, in this scenario, when there's so much of cases around, you have to consider every patient who come to your clinic as a potential threat and a potential patient who could be infected with or without obvious signs and symptoms. So we should be actually, I would recommend them to be taken into your clinic for only after proper regular tests, which include a antigen test, and if possible, RT-PCR is the best possible thing, which can actually give you a safe report and take up the patients with calm and ease without much tension. Then routine blood examination has to be taken to see if the blood parameters are within normal limits. And if you feel all these values are within normal limits, and there's a COVID test which is taken as negative report, and if all the blood parameters are within normal limits, then you can continue with that patient with the regular treatment, maintaining the strict COVID-19 protocols and regulations. Okay, that's about patients who are non-COVID. Now let us move on to the main scenario today, the post-COVID patient who's had COVID-19 treatment or COVID-19 infection, has undergone treatment. In this particular patient, there are so many problems which you have to be worried about, which one has to learn about and be aware of. But let us take it one by one. I've actually included under the management of post-COVID patients under different headings. One would be, what are the problems associated when these patients come to your clinic? Now, what are the problems? We should have an idea and detailed knowledge about things, and that could be connected with the medications what the patient has taken during the post-COVID treatment or during the treatment of the COVID phase. It could be anything related to the immunity that the patient has undergone after this COVID phase, and other opportunistic infections which are also as on the rise in these current days. That also should be a problem and a challenging things for you, and other situations and other hemodynamic balance of the patient. These are the problems associated with the patients who's having this, who's reporting to your clinic with post-COVID signs and symptoms of dental problems. And I would also discuss the management part under various headings. One, I would emphasize on the importance of a history and what are the things that you should look in for this patient when you go for a clinical examination, and how will you detect early signs and symptoms and come to a sort of a suspicious diagnosis or a probable diagnosis, and when should you take up these cases, when and these cases should be referred. Now, the entire scenario of managing patients who's had a history of COVID-19 would be discussed under these two headings. Now, let us take up the problems associated one by one. Okay. Now, under the problems associated, as you know, the first thing is what I mentioned about is the medication related. These patients who's had admitted in the hospital for COVID-19 treatment have undergone a lot of medications, under which steroids are one major component, which is actually plays a very important role in managing the case also. And as far as we are concerned, they actually lower the immunity. As you all know, there are a group of immunocompromised drugs, immunosuppressant drugs. So a patient on long-term steroids with high dose of steroids is again a real positive threat for us to be considered as far as reducing the immunity and making things more difficult for us. Then patient, because most of these patients have this history of or the possibility of COVID-19 induced disseminated intravascular coagulation or multiple thrombi. So they would be mostly on antiplatelets or anticoagulant drugs. Antiplatelets drug, we know, we have heard about ecosprin and clopidogrel and such drugs, but then they are actually put up on anticoagulant drugs too, with more potent anticoagulation effect. And these are not the common drugs what we have heard about. So they would be on usually on treatment on epixaban, okay, and then rivaroxaban and enoxaparin, ranging from different low molecular weight heparin to other anticoagulant, oral anticoagulant drugs. These are the drugs what is actually usually prescribed in patients who are undergone COVID-19 therapy. Now, the patients would be coming with a list of medication, with the patient may not be knowing the details. So it's your responsibility to check all these details in the net or with the consultant doctor and find out what exactly it is. And if they are on this treatment on this antiplatelets, anticoagulants, that is again a challenging task for you to treat patients with this particular medication history. And other medications related to other systemic disorder, anything of that sort also should be under your consideration. So these are the main problems as far as medication is concerned. I repeat once again, steroids, which again brings a lot of problems to us in terms of reduced immunosuppressants and also in terms of making them vulnerable for adrenal suppression, and has to be manipulated. The dose has to be adjusted or manipulated as and when required based on the stress situations. Antiplatelet and anticoagulant again making things more difficult for us in case we are planning for surgical procedures or extraction and things like that. Well, let's move on to the other problem or challenging part. What is actually going to trouble us is the immunity-related problems. Okay. Now, a patient with the diabetes mellitus or patient with uncontrolled diabetes mellitus is again an immunocompromised condition, which is again going to make things difficult for us in terms of wound healing, in terms of difficulty in proper hygiene maintenance, in terms of other opportunistic infections, and the list goes long like that. And most of these patients who had this COVID-19 has got a tendency of hyperglycemic effect. So a patient who's already having an uncontrolled diabetes mellitus tend to develop real high levels of blood sugar level, which is again going to make things difficult for us. And patients who's having they may have transplant, already having some sort of transplants or artificial joint processes, they would be already on steroids and other type of major drugs to prevent these organs getting rejected. So in such patients, when they're again on this attack by this COVID-19, there's a severe drop in immunity, and that's again going to make things difficult for us in terms of managing dental situations, mainly surgical aspect and stress-related problems. Patients on dialysis again, and autoimmune disorders and other disorders. Now, these are the patients whom when we take up a treatment who's had the COVID-19 should be taken up with very cautious precautions, and other measures should be adopted too. Then opportunistic infection is yet another problem associated. Right now, we've seen so many incidences or increase in the incidence of mucormycosis, and even opportunistic infections like candidiasis. Again, candidiasis is not at all threatening, but then mucormycosis has been a real destructive, dreadful fungal infection, which has been reported with so many incidences across the country. and other opportunistic problems also should be thinking about. Now, all these are the three heads under which the problems which we are discussing and the challenges what we are going to face. First, I told you the medication-related problems. The second is basically patients' immunity-related problems, and third is this opportunistic infection. Now, these are the three headaches that we have to face, and we have to actually, come across and do effective treatment considering these things in mind. Well, let's in terms of management, let's move on to the management part. And in management part, first thing I would like to emphasize upon is about the history. In the history, one thing what any patient who's had a COVID-19 treatment, it's very important to get a discharge summary of the patient or a treatment certificate of the patient, because most of the status of the patient in the hospital may not be available, or patient may not be aware, they may not be disclosing these particular aspects. So it's your responsibility to get these things from the patient and make sure that you have all these details, because from the discharge summary and the treatment certificate, we can get a lot of information which you have to. The duration of the stay, definitely the more number of stay in the hospital makes the patient more vulnerable, makes the patient more immunosuppression, again gives us a indication about the type and the severity of the illness, what he has undergone or she has undergone. Whether the patient was in ICU or ventilator, again, a long-term ventilator or long-term stay in ICU, again, is actually making the patient more vulnerable for opportunistic infections. Medications, like I told you earlier, we give this discharge summary or the treatment study will definitely give us an indication about the various medications, include the low molecular weight heparin or other anticoagulant drugs or long-term steroids or high dose of steroids, again, based on which we have to modify our treatment plan. Lung compliance, again, give patients, like the lung compliance, the saturation part, and all these things actually gives, is being described, or the discharge summary will give us a detail of all these things, because everything is connected with the ventilation, everything is connected with the respiration, and patient's ability to, like inspire air properly and take oxygenation and proper ventilations actually should be assessed, and based on that, we have to change our treatment plan accordingly. So these are the important things what I would insist as far as the history is concerned. Minimum avoidable, inevitable questions. These are the things I would say as far as history is concerned from these patients. And of course, recovery status also will get an idea whether the patient is fully recovered or not, or whether the patient is still under care, or whether the patient's condition is still critical, or whether the patient is vulnerable. All these things we can get the idea from these discharge summary and the treatment certificate. And one must definitely insist on getting this thing from all patients who have had COVID-19 treatment. And what are the complaints with which the patients report usually? Now, patient might be complaining of a severe pain or radiating type of pain in the upper jaw. The specificity may not be sure. It might be radiating to the ear. It may be radiating the eyes, the temple region. All these are, signs of, radiating type of pain for the patient. Patient not getting the taste, or the lack of taste sensation, can't chew properly because the patient is having gum problem. Then foul and salty taste could be because of the discharge. The patient is not aware. Then nasal stuffiness. This is very one important point, because this is one of the early signs of patients who's having this fungal infections after a COVID-19 scenario. So these things may not be always, but this is actually one of the early signs. So you should keep in mind these particular signs and symptoms. Of course, headache, a vague headache arising on that particular side of the jaw and the temple area could be again another one vague sign of or early sign of this dreadful disease of the fungal infection. And loss of appetite as part of the disease is part of this particular complaint list what the patient gives, of which this pain and the severe radiating type of pain, nasal stuffiness, and the headache is actually one of the early signs that one should suspect the patient with COVID-19 treatment as to the possibility of a fungal infection, so that early diagnosis can be instituted at the earliest possible. Moving on to the examination part, what one should look for, the intraoral findings, what are the common findings that is possible in such patients with immunocompromised conditions or possible, post-COVID fungal infections. They tend to have a poor oral hygiene. Okay, overall the hygiene would be very bad. Halitosis, foul smell because of the common gingival inflammation and the secretions and the pus discharges. Tooth might be mobile either because of the bone loss and either because of the fungal infection, either because that part of the segment is actually the mobile dento-alveolar segment. The tooth and the particular bone segment could be mobile because of this lack of vascularity, because of that particular segment becoming avascular because of this microthrombi, which is getting, embolized and getting blocking into this particular vessels, which is preventing the particular area from the vascularity and leading to avascular necrosis. Multiple sinuses, infectious sinuses, the discharge may be there or may not be there, but multiple sinus can be seen. Ulcerations, unexpected areas in the tongue, on the palate, and the soft tissues will be finding unexpected ulcerations of no particular reason or no particular cause. Exposed bone, some areas you will find that soft tissues to be eroded and the bone getting exposed. These are all a few of the intraoral findings to be continued. The gingiva appears very unhealthy. Sometimes when you just probe, the gingival tissues might get discharged, and there won't be sign of any healthy gingiva at all. You might be able to find multiple mucosal patches on the tongue, on the buccal mucosa, on the palate, on the gingival tissues. All these are signs that you should look for. Multiple white lesions may or may not appear. Sometimes it can be a white oral thrush or the candidiasis, or it could be other ulcerations as part of these fungal infections. Then saliva overall period of time becomes too copious. That is something what you should also look for as part of this patient with multiple poor oral hygiene. And then teeth might be painful with no specific pain in particular tooth, general pain in areas, especially in the upper posteriors. That's again signs connected with your antral involvement, or that could be also an early sign of this fungal infection. What are the extraoral findings that you should look for? Well, orbital cellulitis is something what you should look for, erythema and around the eye. Okay, nasal mucosal inflammation, one should examine this nostril of the patient. You might be able to notice a nasal mucosal inflammation and enlarged or in a bogey type of nasal mucosa. Then epistaxis patient might give ST, or it might be even clot, which is actually held in or seen in the front of the nostrils. Nasal discharge, it could be a purulent discharge, it could be a blackish skin color, or it should be yellowish in color. Then discolors in the surface of the skin in different areas may appear necrotic or even discolored. Sometimes you might even find erythematous earlier signs in this earlier picture where the skin showing early signs of cellulitis. Then the lip might appear swollen up because of the edema and inflammation and the infection in that area. Then you might notice or elicit a paresthesia or altered sensation or lack of sensation in certain areas, mainly in the infraorbital areas, mainly when this fungal infection spreads and involve the infraorbital nerve and other neurovascular structures. These are now we have had an idea about the various intraoral and extraoral findings, and you should have an idea and should be vigilant, should be very much cautious in examining this patient with acute history of COVID-19 and look for all these possible things. Anything you find, then you should be noticing that, and utmost measures should be taken for the treatment or the referral part. Now, as far as investigations, what is required, as far as the blood investigation, let's see. Now, a complete blood count is mandatory for such patients if you would like to have a notice. Now, what are the changes that one might find in a complete blood count? Well, in that, the total count may or may not be increased depending upon the situation where the patient is. Suppose in the early signs, sometimes you might patients having a broad generalized neutropenia, or in terms of acute infection, sometimes the neutrophil count might be on the rise. Sometimes the lymphocyte count might be on the rise. The total count might be on the rise by virtue of this difference in the lymphocytes and the neutrophil count going high. So lymphocyte count is when it's seen high, you should presume that the patient is having some sort of a subclinical chronic infection. And if the neutrophils is actually seen on the high, then you should consider that as an acute phase of infection and should not take up any procedure in that particular patients. Then as far as hemoglobin, again, gives a definite picture of the oxygen carrying capacity of the patient. As you know, anemic patient, especially immunocompromised, post-COVID, definitely are vulnerable candidates and not good candidates for any definitive treatment. So that again gives a picture about hemoglobin count, whether it should be patients anemic or not, has to be checked for. RBCs and platelets, sometimes count might go low because there's been found to be having a depression in the bone marrow, whereby all the cells from the bone marrow seems to be coming down in terms of number and count. There'll be reduction in the RBCs and platelets, so bleeding tendencies as well as anemia is part of these particular phenomenon that you should make out. Immature cells, presence of immature cells in the blood is also seen in the peripheral smear. This is again signs of like defective WBCs and then defective immune responses. So these are the blood picture that one should look for, and if you get these type of findings, this is what you should infer, and based on these findings. And then the other part, what is very important as far as the blood investigation is considered, is a bleeding profile. Now, these patients might be on anticoagulants, like I told you earlier. It's not just antiplatelet. They they might be on anticoagulants too. So their blood parameters would be definitely changed. So you have to look in terms of values like BT, CT, bleeding time, clotting time, INR, PTT, APTT. Now, BTR is actually bleeding time may or may not be depending upon the clotting factors, but it's a measure of the platelets. So bleeding time may or may not be altered. But since the anticoagulants are being used, the clotting mechanism will be altered. So they might find alterations in the values of the INR, the international normalized ratio, the partial thromboplastic time, and the activated partial thromboplastic time. These are the values of the parameters that will help you to know whether the bleeding profile is within normal limits in case you have to do some procedure, whether bleeding will be an anticipated problem. So these things has to be checked. And of course, as far as I told you, patients under diabetes, uncontrolled diabetes, again, one severe common condition that you see along with this COVID-19 patients with the vulnerable risk of infections. And you should check for the RBS, PPBS, FBS, and make sure the values are within 180 to 200 milligrams per cent. And one thing what I would like to stress upon these patients is you have to check for the HbA1c, because a patient who's having high diabetic level during the phase or during the course of treatment would be on high, strong dose of anti-diabetics. So the value of the blood sugar would be down in that particular period of time when the patient is on medication. But measurement of the HbA1c will definitely give a picture of the last 3 months of diabetic status and will help you to understand if the patient is a regularly controlled diabetic patient or an uncontrolled diabetic patient. A person who's having an HbA1c value more than 6% is having definitely an uncontrolled diabetes over the past 3 months. So even though the other values are within normal limits, then but if an HbA1c value is high, you cannot consider that patient as a safe patient. That patient will really be a vulnerable patient for infections and opportunistic infections. So HbA1c is a mandatory thing in diabetic patients. Your RBS, PPBS, FBS value, if it is almost in the margin level also, but if the HbA1c is not low, if it's too high, then you should not take up that patient for any procedure without the consent of the physician. CRP, reactive proteins, is again a measurement of the inflammatory. This is not exclusively connected or a direct measure of the infection of the COVID status. It's actually seen in most of the inflammatory conditions, in autoimmune disorders or most of the other inflammatory conditions. This is just nothing but a protein which is actually synthesized by the liver and which is released in the bloodstream in response to inflammatory process. So CRP levels going high is not actually exclusive, limited or diagnostic feature of COVID alone. It can be of any inflammatory conditions. These are the blood picture things. Once you check, you will find out and you should be able to interpret. And these are the various findings that you should look for. As far as X-rays are concerned, well, an OPG is must and mandatory, because a patient coming with a simple pain on one or two teeth, if you don't know whether this is vascular necrosis of the alveolar bone. So it's always, OPG is must and must be advocated in such patients, so that you might be able to have an overall picture of the entire maxilla and the mandible. You can also look for any sort of lesions elsewhere and that type of severe mobility of the teeth and things like that. So OPG will definitely help you to a certain extent to understand if any other pathologies are also there. IOPA will be actually just giving a definite, well-defined localized information, but OPG would be a mandatory requirement. And later, now we're not going to prescribe this. I just want to tell you what all things in terms of X-rays can help you identify. A CT with a high contrast will definitely help you to find the extent of this disease I'm talking about, a mucormycosis, where there's a fungal infection, to know the extent of spread of infections. A CT with a high contrast and MRI will definitely give you the extent of infections. I'm sure these things are not within our purview in our case, but we have to check for an OPG and IOP if required, and OPG is a must. And if you have any doubts, then well, you can go in. There's no harm in going for a CT, but if you're going for a CT, go for a high contrast CT, and which will actually give you a picture of the extent of this disease. Now, how to come to a diagnosis? Well, based on the history, I told you have to take a detailed history. I've already mentioned what all things to be covered in the history part. Then based on the clinical examination, I've already explained what are things in the external examination and the internal examination that one should look out for. And then the various investigations, X-ray, CT, MRI, now all these will help in terms of finding a probable diagnosis, but the confirmatory diagnosis based on your fungal culture or a biopsy, which is actually done by an OMFS surgeon or an ENT surgeon. So this is basically how you come to diagnosis. As far as dental surgeon is concerned, only the first two part is within our purview, where in which you have to be very watchful based on the various clinical features and other external internal features, and give the probable diagnosis of a fungal infection or any other diseases like that. Now, coming to the treatment or the management part or the final treatment, well, in patients who's coming to you with the post-COVID, and if the signs and symptoms or any of those what you have noticed from the external internal findings, if there's any such thing suspicious, do not attempt any treatment for that particular patient. You can add, resort to only emergency care, something like pain relief, anything of that sort. Do not attempt any other major procedures in such particular patient. Defer all elective procedures in such patient with COVID positive, COVID treated patient with sort of vulnerable values or any features what you have seen in the clinical examination. If it's positive and suspicious, defer all the elective activity. Do not take up that patient. Do not indulge in any sort of extractions or any other minor surgical procedures which can make things worse for that particular patient. Now that's about a patient, what to do as far as treatment is concerned. If a patient comes to you with a COVID, post-COVID scenario with all these particular positive findings or any of those positive findings or any of those suspicious clinical signs and symptoms. Well, as far as patients who's had a post-COVID phase and 2 or 3 months have passed, but then if their values are within normal limits, if the blood parameters are within normal limits, and then if the other values, including the bleeding profile, are within normal limits, but in such patients, you can definitely go ahead with the treatment. But for any procedures wherein which a wound is induced, like an extraction or an impaction or anything of that sort, in such situation, you have to get the consent of the physician, because the patient might be on anticoagulants, patient might be also on steroids. So even though the other parameters are all within normal limits, even the patient is not having any other active symptoms or signs of infection or anything of that sort, any surgical procedure should be attempted only after the consent of the physician and regarding the anticoagulant therapy and the steroid therapy. All of the dental treatments can be done in such patients. So any post-COVID patients, I repeat, any post-COVID patients who come to you after 2 or 3 months with no signs and symptoms of anything and all blood parameters within normal limits, other than extraction and other surgical procedures, all of the procedures can be done, provided you take the necessary precautions and all the COVID-19 protocol with absolute aseptic precautions and measures. Now, when to refer any patient in the history, when you have taken, you have found any of those signs and symptoms what I mentioned, as in the clinical examination, if you found any signs and symptoms in the list what I have given to you, and when you are in doubt, we are not sure whether you should take it up or not, and then such patients do not do any treatment. So if the history is positive, if there's relevant findings as per the list I have given you, and when you are in doubt, do not attempt any treatment, then such patient you have to refer. You have to refer as early as possible, because you could be the person who's actually seeing one of the first diagnostic indicators of this fungal infection, and referring the patient at the right time will definitely help the patient in a better way. And referring to whom, you can refer the patient to either an OMF surgeon with a hospital attached surgeon, or a hospital attached ENT surgeon, because both of us work hand in hand in managing this particular case, the surgical aspect and further management. Well, I'm just skipping this slide. Well, now to conclude, the main thing I would like to stress upon is you have to look out for the various signs and symptoms. One should be well aware of the various signs and symptoms which is possible or which is likely to be seen in patients with the post-COVID hospital stay, and post-COVID signs and symptoms should be noticed. Well, then you should be having an early diagnosis. Like once you see, you might be, like I told you earlier, you might be the one who's actually finding this in the patient mouth. You might be the one who's actually first time noticing an early sign of fungal infection. So early diagnosis is very crucial and very valuable. So be aware of the various findings or the findings that you should be looking for. And the moment you find any sort of positive findings, or when you have any doubt, refer the patient to the nearest specialist. And your referral and the early diagnosis and referring the patient and instituting the right treatment at the right time would even save a life. As you know, this particular disease can be very spreading and very fatal too. So early diagnosis will definitely help the patient in terms of the severity and the progressing of the disease can be curtailed, and the extent of surgery can be reduced. The amount of deformity can be also reduced. So early diagnosis, prompt referral, and early institution of treatment is the key for this particular thing. And if at all any measures has being done, that has been done with the aseptic protocols. Even though if you're doing work on patients with post-COVID, with, like I told you, few people can come without any signs and symptoms after 2 or 3 months after COVID treatment, no signs and symptoms. But in such patients, other than extractions, you can do any of the procedures. So if at all any procedure is being done, you should do all the aseptic protocol measures, and that is something what you're very careful about it. And extractions and the surgical procedures can be done only after the consent of the physician regarding the anticoagulant therapy as well as the steroid therapy. That is something which I have to tell you all as the take-home message. So you be watchful. You could be the one person who's the first to diagnose a case of an early signs of mucormycosis, and you could be a person who could be saving a person's life too. So be watchful and decide what cases can be taken up and what should be referred, and at the earliest refer such cases. Thank you all for your patient listening. And this is my YouTube channel, Dent-Talks. You can watch this channel and remain updated about further discussion regarding this topic.